we're back here for part 2 of the muscular system. Hopefully I'm a little bit more awake this time. Apologize. So in the first part of the video for this lecture, we talked about the structure of muscle, the functions of muscle, and then we spent a good amount of time talking about the steps of muscle contraction. So now we have a couple odds and ends to finish before we go on to the muscles themselves. So if you recall, we spent a lot of time talking about skeletal muscle. We talked about the structure of skeletal muscle. We talked about the contraction of skeletal muscle. Now what I want to do is I just want to go back just a bit and compare and contrast based on what we learned of skeletal muscle. What's different or unique about cardiac and smooth muscle? All right, so I'm trying to make this as easy as I can, and you can see I've put stars beside what I'd like you to know. If we were to look at, for example, skeletal muscle versus cardiac muscle, structurally they're very similar. Let's talk about functionally. Well, we already know, so this should be starred too, but we already know it. Skeletal muscle is controlled voluntarily, while cardiac muscle is involuntarily controlled. Compared to each other, skeletal muscle contracts at a very high intensity compared to cardiac muscle. Now, this is not to say that cardiac muscle contracts really, really, really weakly, because it has to contract hard enough. Your heart walls have to contract hard enough to pump blood throughout your whole body. But compared to each other, think about your quadricep muscles. They can contract with a lot of force, comparatively much more than the heart. Where the heart has the advantage, though, is in duration. So a skeletal muscle is built to contract at a high intensity, but as a result of such a high intensity, the skeletal muscle cannot hold that contraction for as long. So skeletal muscle is designed high intensity, short lasting. Compared to cardiac muscle, which even though it contracts with a little bit lower intensity, it can stay contracting for a very long time. As evidenced by, every minute that you're alive, your heart is contracting. So when we say long lasting, it contracts every minute of every day, of every week, of every month, of every year of your life. In order to fuel such a long contraction, one of the adaptations to cardiac muscle cells, muscle fibers, is that cardiac muscle has much more mitochondria. I'm not going to ask you the specific percentage, but in terms of the volume of the cell that is made up of the mitochondria, cardiac has much more. So cardiac muscle has many more mitochondria, and skeletal muscle has less. All right. To be honest, we didn't even talk about smooth muscle. Smooth muscle contracts in a slightly different way. It doesn't have the sliding filaments in the same arrangement. So because it's a little bit less common to talk about clinically, we're going to focus on the skeletal and the cardiac. Alrighty. What about the muscles themselves? Okay, here we go. When we look at a skeletal muscle, the middle of the muscle is called the muscle belly, and then either end is a tendon, right? A tendon is a piece of connective tissue, really strong connective tissue, and a tendon is what connects the muscle belly to the bone. Know these two parts. All right. I'm going to give you a list of muscles to know, be able to label them, identify their location, and we also need to give an action, because it's not enough just to know where it is. We have to know when that muscle contracts, what motion is it creating. All right. When we talk about these movements, we have to use the correct terminology. Now, at the very beginning of this semester, we went through some directional terms like anterior, posterior, medial, lateral, superior, inferior. So those were terms to relate things directionally. Things were inner, outer, up, down, to the side, front, back. Well, there's also a specific set of terms for movements, when we move a joint this way versus that way. These are the specific joint movements I'd like you to know. There are more that are joint specific, for example, but you just need to know these. Okay, flexion. I mean, most people probably know, if you flex your bicep, you're doing that. Typically, you could substitute the word bending for flexion. We don't like to be that general. We like to be a little more scientific. Flexion means that a joint angle is narrowed. Extension means the joint angle is lengthened. So look at this picture on the right, extension. So when the elbow is extended, the elbow is the axis in the middle of our lever system. When the elbow is extended, the joint angle is a straight line. So think back to math. A straight line is 180 degrees. When you flex, you shorten that joint angle. Look over here. Now the joint angle of the elbow is a 90-degree angle. So anytime you shorten or narrow, sometimes people prefer that word. Anytime you shorten or narrow a joint angle, it's called flexion. Whenever you increase or lengthen, a joint angle, it's called extension. Now, we can also move joints. Now here we're going to be talking about the shoulder. We can also move joints away from our body or back towards our body. And this is when spelling really matters, because one letter difference changes the whole meaning of the word. Ab with a B like baby. Abduction means to move away from the midline. Some people, this might sound a little cryptic, but some people remember it by if something or someone is abducted, they're taken away from the midline. And then the opposite is to bring something back towards the midline, and that is adduction with a D, like deer. Adduction, some people remember by you're adding it back to your body. And then we have twisting, which is a rotation. We can twist a joint towards the midline, or we can twist the joint away from the midline. We aren't going to be talking about these as much, but still review them. Usually with the rotations, we're thinking about the trunk, shoulder, and hip. Not every joint can do all these motions. For example, the elbow can only flex and extend. It cannot abduct or adduct. It cannot rotate. The shoulder can do all of them. The knee can only flex and extend. So it really just depends. But these are the possible motions. So make sure you go through those. Okay. Now, let's just remember, before you start to stress yourself out, let's just remember that there are over 600 skeletal muscles in the body. That number gets higher, by the way, because of all the smaller muscles in our fingers and our feet, the smaller muscles that move our eyes and our mouth. So of the 600 plus skeletal muscles, how many am I asking you to know? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Now, I think that is very reasonable. Okay, so for this course, I'm asking you to familiarize yourself. In other words, know, be able to label, give the location of, and give a function. 16 muscles, that's it. Okay, so here we have an anterior view of the body, the pectoralis major. I think most of us know that. You don't want to just say pec, because there's actually a pectoralis minor underneath this one. So pectoralis major. Its function is shoulder horizontal adduction. By the way, if you see a capital letter with an apostrophe, that's just shorthand for a joint. Shoulder, elbow, wrist on this slide here. Horizontal adduction means to bring back towards the body, but in the horizontal plane. For those of you that lift weights, like a pec fly, that motion is you're bringing your arm across towards your midline, but in the horizontal plane. It's kind of like a seal. You know how a seal goes, their arms are out in front of them, and then they bring them in towards the midline. The deltoid is really the muscle over the shoulder. It does many things, but its primary action is to, when this muscle contracts, the shoulder will abduct. Please, no one forget the biceps brachii. You're not just going to say biceps, because there's another biceps in the body called the biceps femoris. The biceps brachii, when it contracts, when it flexes, elbow flexion, we have a group of muscles. I am not even asking you to know the specific muscles. If you're interested, on the anterior side of the forearm here, we have the flexor carpi radialis, flexor carpi ulnaris, flexor digitorum longus, palmaris longus, flexor digitorum superficial, I think. We have a lot, but as a group, all these forearm muscles, when they contract, they cause wrist flexion. And then on the back side of the forearm, right, we see a group on the back side, forearm extensors on the posterior side, and they do wrist extension. The rectus abdominis is the six-pack muscle. When it contracts, it will flex at the trunk. The external oblique is the abdominal muscle on the side. Oblique just tells us that the fibers run at a diagonal. This does lateral trunk flexion. So basically, if you were doing like a side bend down this way, but the axis is still the trunk, lateral trunk flexion. The triceps brachii is on the back of the arm, pretty big muscle. It's got 3 different heads. When it contracts, it will extend at the elbow. Trapezius is the upper back muscle. One of its, in general, it moves the scapula, so you can shrug your shoulders. That's called scapular elevation. You don't need to know that, though. Scapular depression, scapular protraction, scapular retraction. And, of course, we recall that the scapula is the shoulder blade, but we call it the scapula. The larger back muscle, it's called the latissimus dorsi. This one does shoulder extension, so it pulls the shoulder back. And then internal rotation, it turns your wrists inward. When I think about this muscle, not that I have any experience with this, but I consider the actions like a handcuff. If someone is handcuffed, their shoulders are brought back behind them, and the way that their wrists are pointed indicates shoulder internal rotation. Larger muscle groups here. On the front, on the anterior side, we have the quadriceps muscle group. When it contracts, it will extend the knee. The adductors are the medial thigh muscles. They do hip adduction. And one of the muscles in the front of the lower leg is called the tibialis anterior. And it does a special motion called ankle dorsiflexion, which is to point your toe up. On the back side, we obviously have our gluteus maximus, our biggest butt muscle, hip extension. The hamstrings is a group on the posterior thigh, knee flexion. And then the gastrocnemius is what we think of as our calf muscle. And it does ankle plantar flexion, which is to point toe down, like you're stepping on a gas pedal of a car. You can imagine some matching on quizzes or exams. I give you a muscle, you choose the correct action. You can totally do this, everybody. Study hard. I'm always here if you have questions.